I'm now going to demonstrate treating the arm, which includes the elbow and the forearm, especially a condition that often occurs in the wrist called the carpal tunnel or CTS syndrome. And it is basically where the nerve and the three branches of nerves can get pinched in here because of the tissue becoming congested, and as a result this nerve gets entrapped. And so the symptoms are oftentimes numbness, in many cases even pain and tingling in the hand, or even pain in the hand. And so if we can zoom to the map up here on the wall, if you look at this forearm here, there's a little band here, that's the carpal tunnel, okay? And as you can see, these muscles here have tendons that go all the way to the hand itself. There's a chart a little further down that is blocked by Abby, but it basically shows that these tendons go all the way here. Now in between there are the blood vessels and the nerves. So when these tendons get congested and swollen, it makes the space too small. And so typically people, and it's too bad, get surgery done where they cut this little band in this area here to open it up. As a matter of fact, I saw a patient today that had the surgery done when she saw symptoms. So what I do basically for this is to, again, use the device and take some gel and, assuming I've adjusted the current, I treat not only this area, but I always treat the muscles also. And sometimes I start with treating the muscles, and then eventually I get down to the wrist area itself. And how I test the nerves to see if they actually are blocked here or are open is to increase the current a little bit. And they tell me when you feel more current. And do you feel anything in the fingers when they work here?
No.
No? How about here?
In your finger?
Thumb?
No. Thumb? No.
Nothing?
Nothing on the thumb.
How about here?
Nothing on the finger.
Okay. Do you feel anything in the fingers here?
No.
Guess what? This man uses a computer a lot. He may not realize that he has actually an early stage carpal tunnel. So let me do a little work in this space here. So by demonstrating, it looks like he may have an early case of carpal tunnel without even realizing it. Because normally when I stimulate here, increase it, he should feel current going all the way to the thumb and to the fingers and the thumb. Do you feel anything here?
Oh,
okay.
I feel it.
So,
Okay.
So I turned it up, not really high, but it's enough to make him jump, as you can see. But that's to prove that the nerves actually are fine. So let me test it here again, and it's up a little bit more than I usually use to treat. Can you feel that here?
Oh, I feel it.
Yeah?
Yeah.
Do you feel anything going in the fingers?
In the finger? Nothing.
Down the hand? Nothing?
Thumb on the thumb a little.
Thumb you feel a little. Okay.
Yeah, I feel it.
Yeah?
On the other finger, not really.
How about here? No?
On the finger?
Not in the hand and fingers. That's here. Okay, so he has a little bit of blockage. So I actually turned the electricity down a bit. I'm going to do about 2 minutes in this area, maybe a little less than 2 minutes. And I'm doing a little work just like a massage, you know. Pretend you're using your thumb to massage the tissues. And while I'm doing this, I'm going to retest that again in a few seconds. All right. So I'm going to turn it up a little bit again, okay? Do you feel anything now?
Oh, yeah.
Anything in your fingers?
In
your hand?
the
How far?
palm, at least.
Okay, show me with your finger, the other hand, how far in the palm you feel it. Show me with your other hand.
Kind of up to here.
And before you felt nothing, right?
Nothing,
Okay.
nothing here at all.
All right. How about this side? Anything?
Nothing.
Nothing? How about here?
I feel it here.
Okay, but not all the way in.
No.
Okay, so let me do a little bit of work in the palm now. Let's see if you've got any See, the little nerves travel between the bones to the side of the fingers. So when the tissue gets tight, it often gets pinched, and it causes numbness in the hand, which is by definition carpal tunnel syndrome. Okay, let me test that again. Do anything here?
Give me
Oh, stop, that's
a...
fine.
Oh, sorry.
Sorry.
Yeah.
Yeah. How far?
Up to here.
Ah, works. Okay, how about there?
Nothing there.
Nothing there yet. Okay, how about here?
Okay,
Up to
here.
more the thumb?
Kind of.
Okay, so here's an example. All I did is work in this area, okay, and then turn the current up a little bit because you need a little more current to make it go down the fingers. But where he couldn't feel anything in the palm before, now you can feel it about here, okay? And how's that feel?
Oh,
Becoming more sensitive, huh?
yeah.
Because I have the current actually quite low now. And so, at first, you actually did a real demonstration on a mild carpal tunnel, okay? But you show that very quickly you basically unblock the area by treating it, and the current is coming back. Now, let me wipe that off and get this gel off your hand. And I just want you to kind of work with your hand and touch things and see if your fingers, you can feel, how does that feel when you work with it? Touch things with it, because that's how you, this hand, I want you to touch things. Tell me when you feel the same as the other hand, or? Not as less on this hand compared to the other hand, or is it the same?
Kind of the same.
The same.
The
Okay.
touch, the sense of touch, kind of same.
It's the same.
Okay.
Okay. So that's good. His nerves are working again, and yeah. Make sure you do some work on yourself and not ignore it. Okay. Especially if you're using the computer a lot. This is an early carpal tunnel. Okay. Now let me quickly demonstrate the elbow. Typical patients complain about either pain here or here. And this is the attachment. This is where the muscle attaches to the bone. And if I can scan over to the map on the wall again, as you can see, here's an attachment to the bone. So oftentimes the pain is here or here, but you see where the muscle goes. Down here, or sometimes it goes up here, or on the other side. Okay? So when you have pain here, not only treat here, but always check the muscle going down or going up, because if this muscle has a knot or band in here, it's tighter, shorter, and it pulls more. And when it pulls, it's the attachment, and that's where the pain occurs, or where the inflammation comes. So in this case, again, I'm going to just start stimulating this area. Now, you don't have any elbow pain, right?
Oh, I feel it when you go.
You feel the curve, okay.
Yeah.
But you don't have any elbow problems, right?
Not that I
Okay,
know.
not that you know of, right? Because you know about that, you didn't know about your back either, so.
That's correct.
Okay. And so I treat this area and then I go down. You still feel that?
I feel the current.
The current? Okay. I just turn it down a little more. Better?
Right.
Alright, okay. So you always talk to your client or patient. Make sure that you get feedback from what they feel. So again, he doesn't seem to have any problems in the muscles, but this is what I normally would do if I dealt with an elbow issue. Work up, work down, and then squeeze my hand hard as you can. Resist. Any pain? Anywhere? Good. That's what I do to test to make sure that the muscles are working, and if they have an issue, it usually will show up, and then you go back and treat some more. And that's basically arms and hand, and of course, you know, you can do the shoulder. And I won't have him undressed, but in the shoulder, it's very complex because there's muscles on the top, on the front, on the back, on the arm, and then even below here, okay? So when I treat the shoulder, I always make sure I treat up here, up here, up here, and then get him to move. Why don't you move your arm up and then straight up in the air, okay? And he doesn't have any problems, no pain, but oftentimes when people want to lift the arm and they lift the shoulder, but now the whole shoulder goes up, it's because they use the wrong muscles. So make sure that when you do that, I also then, bring the arm up and then continue to work the muscles here and all the way down here and all the way in the back. I get him to grab the elbow like this and then stretch while I'm treating these muscles here. And after about maybe 4 to 6 minutes, reevaluate, and if all the knots and all the bands are softened up, that shoulder should have full movement, okay? A lot of people come and say, well, I have a rotator cuff issue or a rotator cuff tear. Well, many people, if you did an MRI, would have, all kinds of little tears and irritation and inflammation. And in my experience, if you work those, treat those, oftentimes it gets better. Okay, we have plenty of testimonies of patients in the States that have been diagnosed with complete ruptures of the tendon, especially this tendon, that after treatment it healed and got better. So again, doesn't heal, doesn't cure, facilitates. The body does the healing.